All right, our patient is Mary Sanford, date of birth 11/12/98, no known allergies. I'm going to ask her if she's allergic to betadine and latex. Low fall risk, full code. She is a 26-year-old female who had a vaginal delivery of her first child 6 hours ago. Let's see here, vital signs look normal for just having a baby. General appearance alert and oriented, grimacing with pain. Cardiovascular normal, respiratory normal, GI normal. GU, she had a Foley catheter while in labor due to an epidural placement. Her Foley was removed prior to pushing, and she has been unable to void since the birth of her child 6 hours ago. Feels bladder pressure, but is unable to void due to discomfort and swelling of the perineum. Skin extremities are good. Neurological, she's alert and oriented to person, place, and time. No neurological defects. Low fall risk, pain in the vaginal and perineal area from birth. Rates it at 4 out of 10. It looks like insert catheter now. Okay, so we're gonna pretend this is shut. But the first thing in my planning stage I'm gonna do is I'm gonna enlist a CNA to help me with a few things. I am going to get a 14 French catheter. This is locked, so there's no tampering with the packaging. There's no rips or tears. It's the right size I need. The expiration date is good. It has all the things I need. Okay, so she has no neurological defects. She's alert and oriented ×3, so I believe she will be able to do the procedure. Things that may make me not be able to put a straight cath in is if the inflammation in the perineal area, if I cannot get to the urethra, and I will examine that when I meet her. Okay, so now I'm going to grab my stuff and I'm going to meet my patient. So I'm going to bring my CNA, hand hygiene, knock knock. Hello, my name is Jake, and this is my CNA. Can I get your name and date of birth, please? She says Mary Sanford, 11/12/98. I'm going to verify that with her wristband. Do you have any allergies to, or at all? She says no. I said, do you have any allergies to betadine or latex? She goes, no. I'm like, okay. So I'm going to do an assessment on you. I'm going to raise your bed, and I'm going to do an assessment to kind of see how I heard you haven't been able to avoid it in 6 hours. So we're going to check that out before we continue anything, but if it is full, I'm going to do a straight cath and I'll explain that procedure in a minute. Sounds good? She says okay. Okay, so we're going to move this down. We're not going to expose more than we have to. Okay, so it's descended. The bladder feels very full. She's grimacing when I touch it. Okay. And the abdomen is distended. Okay, thank you. Okay, so the next thing I'm going to explain to you the procedure. We're going to do something called a straight catheter. I'm going to tap directly into your bladder and empty the bladder, all the urine inside. Do you have any questions about this? She says no. I'm like, okay. If you do, at any time, feel free to ask. So my CNA is going to help me. I'm going to do hand hygiene. Get a pair of gloves on. I'm going to ask the CNA to get a light to shine on the meatus. We're going to start with the exam. I'm going to make sure we can do this. She says okay. I'm observing her facial expressions and how she's doing. Okay. So the first thing, the CNA has the light on. I'm going to look to make sure that she has pain down there and there is inflammation, but I can get to the urethra, so the procedure can proceed as planned. Okay. Thank you for that. I'm going to have the CNA clean you up, do perineal cares, and she says okay. So the CNA did the perineal care, and I'm going to position her into. Okay, so now I'm going to go over and do hand hygiene again. I'm gonna have the CNA make a clean area right there, like my table. It is at working height. Oh, I'm gonna have to do this twice because I put my bag over here. And now I'm gonna go back over and re-sanitize again. Sanitize again. Okay, with my untampered kit and clean space, because I watched the CNA, no one bumped this. I watched them do it. So this place is clean. Okay, I am removing the lid away from me and dropping it. I'm grabbing my sterile gloves first. Going to make sure I stay in that 1 inch border. Okay. Okay, so I have my sterile field. I'm going to grab right here on the cuff so I don't actually touch the glove itself. Maintaining sterility. I'm going to flip this glove over and grab right here on the inside of the cuff right here. Okay, these are on, sterility intact. I'm dropping that in the trash. Does not matter. This is not the one I need first, so I'm going to make sure I don't contaminate my sterile field. I'm making sure this goes exactly where it needs to. Make sure shiny side down. Okay. And now this one. And I would have done privacy as well. I don't know if I stated that earlier, but that's something I would have done. Okay, so now I'm going to grab, making sure I don't contaminate anything. I'm going to bring this right here. This I don't need, so I'm going to go up high. Okay. So I'm going to open the lube, and I'm going to have that right here. How do I do this? I'm going to do it like this. Okay. This is now a dirty hand. And I'm going to grab my first swab. Actually, it's going to be the whichever one comes out. I'm going to do the outside first. I'm going to come around, drop. I'm going to notice her face while I'm doing this. I'm going to do the inside. Drop. And now I'm going to do the center. Drop. Okay, now I lubricated the catheter. I used lubrication on it, so now I'm going to move this forward. So I'll keep it sterile. This side was going to stay in, so I'm going to open the meatus. I see the urethra. I'm going to make sure this stays sterile and this doesn't touch anything. And for females, I'm going to go 2 to 3 inches in, and then an extra inch or 2. In males, I will go 7 to 9 inches in, or until I get urine return. And then I'm going to put this in slowly. Now that's lubricated. Okay, we have hit urine return. I'm going to go a little bit further. Okay, now we have filled this up, and I'm going to, her bladder is empty. I'm going to slowly remove it. Okay. Okay, so now I have the urine. I'm going to remove all this and cover her up right away. Because she doesn't need to be exposed more than she has to. I'm going to remove my gloves and do hand hygiene. Okay, so the first thing I'm going to do is lower the bed for patient safety. After my hand hygiene. To the lowest position. For my documentation for this, I'm going to document the smell, the amount of urine that was collected, if there's anything in it, blood or anything that's in, like matter or anything like that. I'm going to document the patient's experience while I was doing it, my name, and that is it. I'm going to then ask her how she's feeling. I'm going to reassess that bladder to see if it feels soft, and it does. I'm going to do hand hygiene and ask and make sure she has her call light and ask her if there's anything else I can do for her. And she says there's nothing. I said, okay, well, if you need me, I'll be around, and I'm gonna do hand hygiene, grab all my dirty stuff, and leave.